The shadow cast by AIDS since the HIV virus was identified nearly 30 years ago has extended into every nation, culture, and society on the planet. It's left millions dead, millions more abandoned, and countless families, communities, and hearts broken. Antiretroviral drugs and other scientific breakthroughs have given people hope of longer, more productive lives. But there's no vaccine against the fear and stigma, judgment, and rejection faced by the infected. This is where the human touch, and for people of faith, the presence of God is needed. Yet faith communities have been slow to respond and often quick to judge and condemn. That's what two faith leaders from widely divergent contexts found. One an Armenian Orthodox priest and the other a Kenyan sheikh. One discovered it among fellow believers. The other found it lodged deep within his own heart and basic beliefs. Sheikh Hassan Omari, the leader of a mosque in Nairobi, was shocked by the wrath and rejection of his congregants when he proposed that people with HIV and AIDS should not be condemned. He was accused of supporting prostitution. Father Javand, an Orthodox priest in Armenia, was aggressively intolerant of people living with HIV. He believed their disease was a sign of God's judgment and condemnation, and that they should be despised. Then, each man encountered channels of hope, which would transform their ministries and their lives. Channels of Hope was created by CABSA, the Christian AIDS Bureau for Southern Africa. World Vision, a global Christian relief, development, and advocacy agency, adapted and expanded this approach, first with pastors, then to a broader scope of Christian traditions around the world. Muslims joined the movement when the Mufti of Zambia asked World Vision to adapt it to their faith. Channels of Hope was a natural fit with World Vision's fourfold response to HIV and AIDS: training and equipping caregivers, promoting prevention with children, youth, and adults, providing support to those living with HIV and AIDS, and caring for the orphans and vulnerable children left behind. But none of these things can be accomplished if people and their communities are frozen by fear, lack of knowledge, and prejudice. Channels of Hope equips faith leaders to overcome these obstacles, mobilizing communities to support and link patients to proper medical care and ART therapy. At a typical Channels of Hope workshop, Christian and Muslim leaders separately work through guiding principles from their own scriptures. Next, they come together to share across faith lines. They learn about the realities of AIDS, combating fears, myths, and prejudices, understanding the need for comprehensive prevention. Sheikh Hassan returned to his mosque with a new way of speaking about HIV and AIDS. Now, people confide in him about their status and seek his help and guidance. Muslim women are reaching out to care for people infected and affected by HIV and AIDS. Sheikhs and imams talk openly in mosques, breaking the deadly silence that causes many to hide their infection and suffer alone. Father Javand had a profound change of heart and a radical transformation of his ministry. He's now a compassionate and outspoken faith leader combating the stigma of AIDS. He serves people living with HIV in 35 communities. He's trained teachers, health providers, parents, and nearly 10,000 children, mobilizing them to spread the message of acceptance, prevention, and hope. Channels of Hope is continuously being enriched by new participants: churches, mosques, community leaders, local businesses, NGOs, international agencies, and government at all levels. Nearly 17,000 Channels of Hope workshops have been conducted worldwide with more than 400,000 participants. More than 110,000 pastors, priests, sheikhs, and imams have been trained. Faith leaders have mobilized 46,000 congregation-based volunteers in Africa alone. These volunteer caregivers play a crucial role, ensuring home-based care, outpatient case management, promoting testing, and counseling at-risk pregnant women and mothers of newborns. And the Channels of Hope approach is expanding to address maternal and child health, gender, and child protection, bringing faith leaders and communities together to influence positive behavior change for the well-being of children. Each faith has its own dictates about caring for others. Channels of Hope is about working together to love God and our neighbor, enriching each other's efforts, living out our golden rules, bringing hope and relief from suffering to men, women, and children.